Welcome to JS Wellness and Cell Nutrition. JS Wellness and Cell Nutrition believes in holistic health and nutrition for optimum healthy lifestyle. Living well with optimum health is possible for anyone who is willing to make a serious personal commitment and to take full responsibility for his or her own well-being. Living and staying healthy is no longer an option in life. We must cultivate and live an optimum healthy lifestyle to enjoy the best of life. Hi, I am Joshua. I have started this JS Wellness and Cell Nutrition sharing, educating and helping people to live an optimum healthy lifestyle. Today, in this JS Wellness and Cell Nutrition video, I am going to share about the causes and symptoms of the chronic disease called diabetes. Diabetes is a disease in which the body either does not produce or cannot properly use the hormone produced by the pancreas. After eating a meal that contains carbohydrate or protein, the blood sugar normally rises. This increase in sugar triggers a release of insulin from cells in the pancreas called beta cells. The insulin opens the doors of cells throughout the body, allowing glucose to enter them. As glucose enters the cells, the blood sugar level falls back toward normal, and the release of insulin tapers off until the next intake of foods. Insulin helps to control the amount of glucose, sugar in the blood, and the rate at which glucose is absorbed into the cells. The cells need glucose to produce energy. Diabetes mellitus, commonly referred to as diabetes, is a chronic disorder. It occurs when the pancreas does not secrete enough insulin, or when the cells of the body become resistant to insulin. In either case, the blood sugar cannot get into the cells for storage, which then leads to serious complications. High blood sugar is a modern-day metabolic disorder. There are over 33 million people with diabetes, and over 80 million diagnosed with prediabetes in the USA alone. The following key facts are extracted from World Health Organization website. The number of people living with diabetes rose from 200 million in 1990 to 830 million in 2022. 1. Prevalence has been rising more rapidly in low and middle-income countries than in high-income countries. The global prevalence of diabetes among adults over 18 years of age rose from 4.7% in 1980 to 8.5% in 2014. Between 2000 and 2016, there was a 5% increase in premature mortality from diabetes. In 2021, diabetes was the direct cause of 1.6 million deaths, and 47% of all deaths due to diabetes occurred before the age of 70 years. Another 530,000 kidney disease deaths were caused by diabetes, and high blood glucose causes around 11% of cardiovascular deaths. Diabetes is a major cause of blindness, kidney failure, heart attacks, stroke, and lower limb amputation. In 2016, an estimated 1.6 million deaths were directly caused by diabetes. Another 2.2 million deaths were attributable to high blood glucose in 2012. World Health Organization estimates that diabetes was the 7th leading cause of death in 2016. Diabetes causes blindness, kidney failure, heart attacks, stroke, and lower limb amputation. In 2021, diabetes and kidney disease due to diabetes caused over 2 million deaths. In addition, around 11% of cardiovascular deaths were caused by high blood glucose. A healthy diet, regular physical activity, maintaining a normal body weight, and avoiding tobacco use are ways to prevent or delay the onset of type 2 diabetes. Diabetes can be treated and its consequences avoided or delayed with diet, physical activity, medication, and regular screening and treatment for complications. The IDF Diabetes Atlas 9th edition 2019 provides the latest figures, information, and projections on diabetes worldwide. The IDF Diabetes Atlas 2021 reports that 10.5% of the adult population, 20 to 79 years, has diabetes, with almost half unaware that they are living with the condition. Approximately 537 million adults, 20 to 79 years, are living with diabetes. The total number of people living with diabetes is projected to rise to 643 million by 2030. By 2045, IDF projections show that 1 in 8 adults, approximately 783 million, will be living with diabetes, an increase of 46%. The proportion of people with type 2 diabetes is increasing in most countries. 79% of adults with diabetes were living in low and middle-income countries. 1 in 5 of the people who are above 65 years old have diabetes. 1 in 2, 232 million people with diabetes were undiagnosed. Diabetes caused 4.2 million deaths. Diabetes caused at least USD $760 billion in health expenditure in 2019, 10% of total spending on adults. More than 1.1 million children and adolescents are living with type 1 diabetes. More than 20 million live births, 1 in 6 live births, are affected by diabetes during pregnancy. 374 million people are at increased risk of developing type 2 diabetes. Over 90% of people with diabetes have type 2 diabetes, which is driven by socioeconomic, demographic, environmental, and genetic factors. Insulin is a hormone that regulates blood sugar in the body. Diabetes is a chronic disease that occurs in the body either when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Thus, glucose builds up in the bloodstream instead of being taken into and used by the cells, causing a raise in blood sugar level leading to hyperglycemia. Consistently high blood glucose levels in the body, and if it is not well managed and controlled, diabetes can lead to heart disease, kidney disease, edema, nerve damage and infections of the mouth, gums, lungs, skin, feet, bladder, and genital areas. Skin sores may develop and fail to heal properly. In almost all high-income countries where people are living in modern lifestyle, diabetes is a leading cause of cardiovascular disease, blindness, kidney failure, and lower limb amputation. Type 1 diabetes. About 10% of all people with diabetes have type 1 diabetes. This is when the pancreas does not produce enough insulin, causing insulin production deficiency in the body. People with type 1 diabetes will require daily administration of insulin. Type 1 diabetes can affect people at any age but usually develops in children or young adults. People with type 1 diabetes need daily injections of insulin to control their blood glucose levels. If people with type 1 diabetes do not have access to insulin, they will die. The following are some of the most common symptoms of type 1 diabetes: abnormal thirst and dry mouth, sudden weight loss, frequent urination, lack of energy, tiredness, constant hunger, blurred vision, bedwetting. Type 2 diabetes. This is the most common type of diabetes. About 90% of all people with diabetes have type 2 diabetes. This is when the body is not able to utilize and use insulin effectively or insulin resistance, where the body does not fully respond to insulin to maintain healthy blood glucose level. For some cases, this can eventually exhaust the pancreas, resulting in the body producing less and less insulin, causing hyperglycemia and even higher blood sugar level. Type 2 diabetes is most commonly diagnosed in older adults, but is increasingly seen in children, adolescents, and younger adults due to rising levels of obesity, physical inactivity, and poor diet. The following are some of the most common symptoms of type 2 diabetes: excessive thirst and dry mouth, frequent urination, lack of energy, tiredness, slow healing wounds, recurrent infections in the skin, blurred vision, tingling or numbness in hands and feet. These symptoms can be mild or absent, and so people with type 2 diabetes may live several years with the condition before being diagnosed. It is advisable to maintain a healthy diet, increased physical activity, and a healthy body weight in order to avoid type 2 diabetes, which may be diagnosed several years after complications have already arisen. Gestational diabetes. Gestational diabetes is hyperglycemia with blood glucose values above normal but below that diagnostic of diabetes. Gestational diabetes occurs during pregnancy. Women with gestational diabetes are at an increased risk of complications during pregnancy and at delivery. These women, and possibly their children, are also at increased risk of type 2 diabetes in the future. Gestational diabetes is diagnosed through prenatal screening rather than through reported symptoms. Impaired glucose tolerance and impaired fasting, glycemia. Impaired glucose tolerance, IGT, and impaired fasting, glycemia, IFG, are intermediate conditions in the transition between normality and diabetes. People with IGT or IFG are at high risk of progressing to type 2 diabetes, although this is not inevitable. These symptoms may occur suddenly. Symptoms are as follow: excessive excretion of urine, polyuria, thirst, polydipsia, constant hunger, weight loss, vision changes, fatigue, health impact, and diabetes complication. In the long run, diabetes can cause damage to the eyes, the kidneys, the heart, the blood vessels, and the nerves. The damage of the blood vessels and the nerves, neuropathy, in the feet leads to reduced blood flow, thus causing foot ulcers and infection which eventually lead to the need for limb amputation. Adults, especially with diabetes, have a 2 to 3-fold increased risk of heart attacks and strokes. Diabetes is the cause of 2.6% of global blindness. Diabetic retinopathy is the result of prolonged accumulated damage of small blood vessels in the retina of the eyes, causing eyesight problems. Diabetes is also among the leading causes of kidney failure. Take necessary and appropriate precaution will help prevention of diabetes. Healthy nutrition and physical activity. Maintaining healthy blood glucose levels through regular physical activity, which includes a combination of both aerobic exercise like jogging, swimming, cycling, etc., and resistance training. Another important key to prevention of diabetes is healthy lifestyle through healthy diet and proper nutrition. This includes reducing the amount of calories for overweight people, replacing saturated fats, example, cream, cheese, butter, etc., with unsaturated fats like avocado, nuts, olive and vegetable oils. Increase dietary fiber intake like fruits, vegetables, whole grains, etc., and avoiding tobacco use, excessive alcohol and added sugar. Therefore, eating natural healthy diet, proper nutrition, regular exercise and physical activity, quitting smoking, avoid unhealthy fat and high sugar foods, etc., will help you live and stay healthy away from diabetes. That's it for this video. I hope you learned a few tips through this J.S. Joshua Wellness and Cell Nutrition channel. Do subscribe, give a thumbs up, and share this video to friends around you. Should you be interested to know and learn more about how to build a successful wellness network, to earn passive income and achieve financial freedom, which I have been earning more than 10 years, you may go ahead to scan the QR code or click on the link. I will be in touch with you to assist you to learn more about my wellness business.
Disclaimer. This is not get-rich-quick scheme or easy life money without hard work. If you are looking for such thing, sorry, this is not for you. We never believe that anyone can achieve great success with wealth and freedom without having to work hard through genuine success.
May God bless you with good health, prosperity, wealth, and great success all the days of your life. Take care. God bless you and family. Thanks for watching.
That's all for today. Always remember this. You are born to win, engineer for success, destined to be somebody great in life. All things are possible in life. You are born to be a winner. May God bless you with great success, wealth, health, and prosperity all the days of your life. Remember to subscribe, click on the subscribe button and the notification bell. Thanks for watching.